Welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Cherie, the health educator for MS Focus, and I'm joined by Cherie, who will be taking your questions today about managing your MS symptoms or dealing with your diagnosis. After the presentation, the presentation is the discussion. So I'm delighted to introduce our speaker to you. Cherie is a registered nurse with an additional degree in gerontology and is also an internationally certified multiple sclerosis nurse. She's our patient healthcare liaison, a writer for our MS Focus magazine, and a regular presenter of patient education programs for the Multiple Sclerosis Foundation. Cherie was diagnosed with relapsing remitting multiple sclerosis in 1994 and has found that adopting some changes in her lifestyle has made her MS much easier to manage. We're pleased to have her join us to present this important discussion. Cherie, thank you for being with us. Before I turn it over to you, I just want to let our audience know how we're going to be navigating the Q&A today. So if you have a question, you can use the Q&A button in the Zoom app. It allows you to send your question anonymously if you choose to do so, or you can ask your question live by raising your hand. To do that, click the raise hand button or press *9 if you're on the phone. I will call on you and you can unmute yourself and ask your question. Now, Cherie, I'm going to turn it over to you for our Q&A.
Thank you, Bhavya. Thank you. Before we get started, there's a couple of things I wanted to bring to your attention. The MS Foundation, MS Focus, does an annual cooling program every year from February 1st to June 1st. We've got just under 6 weeks left in that program to get your application in, should you need cooling equipment as the warm weather begins to descend on us. There is an application in the winter issue of the MS Focus magazine. It's on page 47 and page 47, the cooling application. The back of that page also has a list of the different items, pictures the different items that are available for you to check off what you need. Now, if you have received cooling equipment from us in the last 5 years, we can't look at your application this year. You have to wait for 5 more years after we've given you product. But there are certainly, we can certainly give you the links for companies that provide those equipment for you. Another announcement is that as of yesterday, the CDC has come up with new vaccine recommendations for the COVID vaccine. The new bivalent booster, which came out early last fall, is, as of yesterday, available for a second dose for anybody who is immunocompromised or over the age of 65, provided you've had your first dose of the bivalent vaccine at least 4 months ago. And moving forward, that will become the standard, either Moderna or Pfizer, for the bivalent vaccine. The original vaccines are now determined not to be as effective against the current variants that are out there. And one last announcement before I start taking your questions is that we now, as of yesterday, have a new Facebook community that is closed, it's private, it's a safe space for conversations for those members of the MS community that identify as LGBT or Q. And the name of that, if you wish to search for it, is MS Focus on the LGBT community. So we look forward to having those of you for whom that would be a safe, comfortable place to join us in that space. And now I will be happy to answer any questions if you want to tick them into chat or Q&A, or if you wish to raise your hand at the bottom of your page. If you're on Zoom, just hover over the raised hand section. It's just to the right of center at the bottom of your page. If you're on Facebook, you can tick things into the Facebook comment section, and Bobia will send them over to me in chat. Shalane says, I'm currently experiencing a relapse for the first time. My vision has been severely affected from the beginning prior to my diagnosis. It's taken a plunge since the relapse. I just had Ocrevus on Monday. Any recommendations? You did get some steroid with your Ocrevus, so that may help to kind of get over this a little bit more quickly. I would try to stay off of media for a period of time with the vision, just so you're not stressing your eyes at all during that time. Cell phones, computers, tablets are, you know, stressful on that optic neuritis, on the vision loss. So try to minimize that and just be patient. This does let up after a period of time. An anonymous attendee says, recently I'm not comfortable getting on escalators. I'm fine once I get on, but I'm petrified about going down, and now I have to take an elevator. Do you know what could cause this new symptom? I think it's related to anxiety. I don't think it's so much an MS situation as it is anxiety. And there are certainly people out there to help you learn to deal with that anxiety. So it might be a good idea to come to reach out to a mental health professional or your family practice doctor, your primary care doctor, or even your neurologist. They may have somebody that they can recommend. Let's see. One other thing I wanted to mention is that I found out a couple of days ago that our summer issue of the MS Focus magazine is going to be focused on relationships. So if you're having difficulty in a relationship that seems to be around your MS diagnosis, you may find some help with that magazine when it comes out. We're also going to have our Ask the MS Nurse column in that magazine, and we will be printing any questions that come into me related to relationships. So you may be able to have an answer publicly in the magazine, should you choose to do that. Any other questions? I've been seeing questions lately on our Facebook page from some of you who are needing to start doing intermittent self-catheterization. We do have some literature that can help you with that. We've had a couple of conversations on our Facebook pages that can help with that. So feel free anytime something like that comes up to reach out to me. The MS Foundation information is behind me on my screen. You can also, if you have a question that you would like to have answered more confidentially, you can certainly email me at Cherie, that's Cherie, at msfocus.org. Ben says, I may be choosing a new primary care physician. As someone with MS, is there anything particular to look for? My primary care physician has about 100 people with MS in his primary care practice. You might certainly ask, does this provider have people that they're caring for who are living with MS? Are they open to learning about MS? Those are the kinds of questions I think I would ask. And I hope you find somebody that is helpful. Stephen from Facebook says, can you speak more about balance and motion? I think a lot of us, Stephen, have problems with balance, particularly when we're in motion. Some of that is from something that we call proprioception. It's our ability to determine accurately where we are in time and space. Even if I'm looking at my feet, sometimes because I have a visual deficit in one eye, I may not always see in full 3D, and I'm not exactly sure where things are. Physical therapists who are trained to deal with MS are very good at helping us to learn how to navigate safely, both balance-wise and in forward or reverse motion. So I would recommend that you ask your healthcare professional for a prescription for a physical therapy evaluation. An anonymous attendee says, I'm dealing with severe fatigue. It's affecting my mobility. I take Ampura for walking. I sleep 7 to 8 hours a day, and I still get tired fast. Is there anything else I can do? I would say that's not enough information to really fully answer your question. Ampura does not always help with fatigue. It started out, the drug, the famotidine, the drug that is the basis for Ampura, started out as a compounded medication to deal with fatigue. And what we found over time was that people that were taking that were actually improving their walking speed and their gait. And so it went on the market as a medication for gait. Only about 40% of people taking that drug, however, actually see relief from it. And if you're taking it, you're going to see a difference in your walking or in your fatigue within 2.5 to 3 weeks of the time you start the drug. If you're not seeing any improvement after 3 weeks, don't even bother to get the prescription refilled. So I think, more than half of us have sleep problems with MS, and it might be helpful to you to even have an in-home sleep study done. Ask your primary care or your neurologist about that and see if they aren't picking up on something else that you may not be aware of and that might be helpful to you. Let's see. We have Louis or Lewis, I'm not sure which. I'm in the UK. I love this site. My husband announced he was leaving me after a 10-month affair. His excuse was he couldn't cope with my MS. I was diagnosed 13 months ago and had no remissions. He said he didn't know how to deal with possible remissions. I'm strong. I will fight this with the help of natalizumab. Good for you, Louis. Again, it sounds like your husband is just really fearful, anxious, and it could well be that some counseling for him or for the two of you could be a real help to the relationship. I'm grateful that you're being proactive and taking care of your MS, but I think a mental health professional may be needed in this situation. An anonymous attendee says, Ocrevus is the treatment I am on for my relapsing remitting MS. I've only read about the one study about the effectiveness of COVID vaccines for people on Ocrevus. That report indicated that for people receiving Ocrevus who've received their vaccines, 90% have a chance of having zero antibodies. That seems bad, even with T cells doing their part. Are there other studies indicating how extra vulnerable those of us on Ocrevus might or might not be? The study I saw didn't indicate which particular vaccines were received by those in the study. Thank you. Again, if you missed the beginning of this webinar, yesterday the CDC did give approval for an extra dose of the bivalent vaccine for anybody who is immunocompromised, and that includes those of us who are on Ocrevus, Rituxan, Truxima, Briumva, is that Briumvi, and possibly Kesimpta. We're not 100% sure, but those medications particularly can keep us from mounting a really robust response to the vaccine. The only vaccines moving forward as of next month that are going to be utilized for COVID are the new bivalent vaccines from Pfizer and from Moderna. The original vaccines will not be given anymore, as they are no longer considered effective against the current variants of the COVID virus. Rachel from Facebook asks, I had to have 3 of my vertebrae in my neck fused just a little under a year ago. I was diagnosed with degenerative disc disease. Is this common with MS? And what would be good to relieve pain and discomfort and future problems? I've also had cervical fusion. My husband's had 2 different cervical fusions from degenerative disc disease. My husband doesn't have MS. Generally, degenerative disc disease is from prior injuries, could have been decades ago. Most notably from something like a whiplash injury, where you've had a sudden stop and your head is bounced forward and back. That can compromise the discs that cushion the vertebra. It is not MS related, and it does not impact your MS. As far as pain is concerned, any opioid pain medications are probably not going to be helpful to you in the long term. They may actually make the pain worse, may actually make it rebound. So something like an NSAID, ibuprofen, Aleve, something like that, can be utilized if the pain is not manageable, but it's not going to take the pain away. You might want to talk to your doctor about a pain management clinic. An anonymous attendee says, are there timing guidelines for getting the bivalent COVID vaccine when taking a DMT? I'm on Kesimpta. Should I get it 2 weeks before or after? It doesn't. We used to think at the beginning of our vaccine usage, end of 2020, early 2021, that if we were on a medication that was every 6 months, like Ocrevus or Rituxan, that we would want to get it a month before the next infusion when our levels of medication were beginning to wane. We thought that it would give us the best possible chance at developing antibodies. We now know that any of us who've been on these B-cell depletion medications for longer than 2 or 3 years, we are maintaining pretty stable levels of the drug in our system. So it can actually be gotten at any time during that course. Shelley says, I have primary progressive MS. Is it possible to deteriorate in a very, very short period of time? With primary progressive, a rapid deterioration is not normal. If you're deteriorating rapidly, I would suspect something like a urinary tract infection that doesn't present typically. And both men and women can experience a progression like this without any real cause other than an infection that may be hidden. It could happen if you've gotten a slight cold. It could happen if you have contracted COVID and maybe have asymptomatic COVID. Anytime there's any kind of infection. So I think I would, have a conversation with your primary care and let them sort of ferret out whether or not there is an underlying cause that could be doing this, and certainly let your neurologist know that this is happening. Let's see. An anonymous attendee says, is yoga a good alternative for anxiety of newly diagnosed? Sure can't hurt. I think it likely will help. Certainly being aware of your breathing, of, just doing, sitting, closing your eyes and just doing a body scan. Where in your body are you uncomfortable? Are there specific thoughts that are running through your head regularly? If so, write them down and put that paper away so it's out of the way. I just think that there are a number of different anxiety reduction tools that you might find. YouTube has all sorts of meditation short videos that could be helpful to minimize anxiety. Shalane says the AC went out in my car and it's going to be in the 90s on Friday. Do I need an estimate prior to applying for the car repair program? I've never applied for this. An AC going out in a car is probably, yes, it would be good to get an estimate before applying, but it's probably not going to be fully covered by our car repair program. Most of our grants have a cap of about $500 on the cap. And I know my daughter just got an estimate for getting her air conditioner replaced, and it was about, the compressor was gone, and it was about $2,300. If it's just charging the air conditioner, then it may be less than that. But yeah, I would go ahead and do that. Let's see, an anonymous attendee, what can help with continuous falls? I already use a walker. I may sound like a broken record on this, but you need to be seeing a physical therapist. They have fall prevention programs. They can give you things to do that will strengthen your core, the central part of your body. By having that stronger, you're more likely able to forestall a fall or to catch yourself before you actually go down. Ellen from Facebook asks, is there a recommended minimum number of Ocrevus infusions I should have before trying to conceive? I've had 4 of them, so far 6 months apart. I'm 30 and was diagnosed 2 years ago. I would say the time would be right. You've got, a good level of control of the inflammation from your MS under your belt right now with 4 Ocrevus infusions, 2 years. You're at a peak time to be able to conceive. If you wait another 5 years, it could be too late. So I would have that talk with your neurologist and set up a plan of what you might want to do to look at if they feel like there should be an alternate medication on board before conception. But certainly, we've got several articles on pregnancy, on fertility, on how they relate to our disease-modifying therapies when we have MS on our MS Focus online magazine. So that would be msfocus.org/magazine. And look up getting pregnant with MS. Any supplements you would recommend for helping with sleep? I'm currently taking Z-Quil, but not sure if that's a good idea or harmful. Z-Quil is Benadryl, basically. And it can be very drying. For some people, it can actually raise their blood pressure. It's an antihistamine, so if you've got seasonal allergies, it may be helpful, but you don't want to be relying on it long term. I would say something like low-dose melatonin. It's out there in several different doses. 5 and 10 milligrams are kind of the most common, and yet some of the studies that have been done on sleep supplements are showing that about 2 to 3 milligrams of melatonin is really all it needs. That some people have less good sleep on the higher doses than they do on the low dose. Valerian is another herbal supplement that tends to cause some sleepiness. Some people do really well on it. I find that when I tried it several years ago, it tended to be a little nauseating for me. So it worked better if I took it with a little food, but you don't want too much heavy food near bed. And I would take it within a half hour of the time you plan to get into bed and turn off the lights. So valerian and melatonin likely helpful. Let's see. Is it safe to take Adderall long-term for fatigue? That's really a question you want to ask the prescriber for that. It can be not, I wouldn't say addictive, but it can cause a physiologic response in your body that craves that when you start to cut back on the dose. If it's not helping your fatigue, then that's a conversation you probably need to have with your provider and set up a plan to wean yourself off of it. Can stress, another anonymous attendee, can stress slow or stop remission from a relapse? I had a relapse from last March and I still haven't fully recovered, but I've gotten better. Will I ever recover, or is it just the MS? That depends. Are you on a disease-modifying therapy? You haven't mentioned that. You can recover from your relapses fully, particularly if you're on a disease-modifying therapy. If you've not yet gone on to a disease-modifying therapy, you may never fully recover from a relapse. Or you can start to recover and then have another relapse that can make that worse. So you're gradually going downhill rather than leveling off and staying leveled off. The disease-modifying therapies do work quite well to prevent further damage from happening in the central nervous system so that you're not getting worse. The average relapse takes 3 to 4 months to get over. So if your relapse was in March and it's now nearing the end of April, you're still right in the middle of it. So don't just be patient. It will work its way through, but I would get onto a disease-modifying therapy if you're not already on one. Can you explain how Botox injections in the bladder work? In your experience, does it help? Botox is a paralytic. So whether you're using it cosmetically to take away wrinkles so that the frown lines don't happen, you can't like make those frown lines because it paralyzes the tissues in the area where it's injected. It does the same thing in the bladder. So if you have a hyperactive bladder that's causing you to leak or to have to go to the bathroom really regularly because it's contracting, it paralyzes those muscles so that they relax and your bladder can fill. And as your bladder fills, you may have a response that tells you after you've got about a cup of urine in your bladder that it's time to go. For some people, once they've had Botox, they're not leaking anymore, but they may need to use a catheter to empty the bladder fully of urine 3 or 4 times a day. And yes, everybody that I've talked to that has had this says it's a life changer for them. So I would encourage you to look into that. Let's see. I don't see any more questions in either the chat or the Q&A. So folks, if you've got a question burning, please feel free to answer it or ask it. I did have somebody ask me about what do I do? They're newly diagnosed. What do I do for my cousin keeps coming up with all this literature that they're sending me since they found out I was diagnosed with MS. And it talks about MS cures and things that I should be trying. How do I deal with that? And I will tell you right now, there are no cures for MS. There are no diets that cure MS. There are no supplements that cure MS. If you have a relapsing form of MS, if you have relapsing remitting MS, as 85% of people diagnosed with MS do, your MS is naturally going to quiet down, particularly if you've made lifestyle changes that are helping to calm inflammation generally in your system and in your central nervous system. So you could change your diet, or you could be exercising and you could be getting better. You could be feeling better. You could have more energy. You could be walking better. That's the natural course of relapsing forms of MS. You have a relapse, and then the inflammation calms down and those symptoms dissipate and you feel better. And a lot of these interventions, whether they're supplements, whether they're diets, bank on the fact that you're going to feel, if you're using their product, that you're going to feel as if it's working and as if it's cured the MS, and you're going to keep buying it. Don't be lulled into that. There is nothing currently that will cure it. There are many things that we can do to make it better. So thank them for being concerned about you and sharing the information, but let them know that this is a scam. Thank you. Ben says, not a question. You've helped me with questions about Medicare a couple of years ago. I just want to say thank you. Oh, Ben, thank you. Medicare is kind of tricky when you're beginning to navigate it and you have MS. So yeah, and again, as patient healthcare liaison for the foundation, I'm available to any of you anytime. Just feel free to pop me an email, Cherie, Cherie, at msfocus.org, and I will answer those questions. An anonymous attendee says, can turmeric help with inflammation? There is a lot of evidence that turmeric is anti-inflammatory and it may be helpful, but if you're just taking ground turmeric as a spice and sprinkling it on your food, or adding it to your soups or stews or things like that, it probably isn't a high enough concentration of it. And getting a turmeric supplement that's US Pharmacopoeia. So if you see on a medication bottle, USP, that's US Pharmacopoeia, and it's kind of like the FDA for supplements. And what it does is it tests that supplement to make sure that they have what they say is in that product for the strength. So I would say get a quality turmeric product. Do not go to GNC. GNC often has or those types of chains that sell vitamins and supplements are not US Pharmacopoeia certified, and what's on their shelves consistently does not test for the active ingredient of the product that they're selling. So your best bet is to go to your CVS or your Walgreens and get the store brand, or something like Nature's Bounty or Nature Made. Those products you can be pretty sure have exactly what they say is in them. Mary from Facebook says, any advice for swelling ankles? My neuro says it's a secondary condition and suggested compression socks and elevating legs, but I'm not seeing improvement. By the way, I've been thoroughly evaluated by a rheumatologist for other problems, all clear. Dr. Thrower addressed this in his Ask the MS Specialist a couple of weeks ago on our Facebook page and on our YouTube channel. He said that the majority of people with MS, particularly as they get older, will notice some swelling of their ankles. And compression stockings are the best way to deal with that. If there is another underlying problem, and it could be cardiac, it may not be rheumatologic, You may need other supplemental medications such as a mild diuretic to help get that fluid off. But compression stockings and elevation are the best way to take care of it. What I've found over the years is that even though I hate sleeping with socks on, if I really have swollen ankles and feet, the best bet is to put that compression stocking on as I'm getting into bed at night. My legs are then elevated all night long as I'm sleeping. So when I take the stockings off in the morning, the swelling has gone down. For me, I find that it's much worse in warm weather. And also, I find that the more walking I do, particularly if it's on uneven ground, I may end up with more swelling. So the compression stockings, although they're not necessarily all that comfortable, may be your best bet in getting rid of that. Let's see. Let's see. What are your thoughts on, this is an anonymous attendee, what are your thoughts on taking D-mannose daily for UTI prevention? It may be helpful, but I'm not 100% certain. I would say that something like a high concentrated cranberry might be just as helpful for something like that. The other thing is, if you're drinking citrus juices, citrus has a tendency to erode the protective mucosal lining of the bladder that keeps urinary tract infections at bay. So you may want to cut back or cut out your citrus for a few weeks to see if there's an improvement in your urinary symptoms. And let's see, Vicky. Can you please repeat the answer about help for a broken car air conditioner? Mine is currently not working and summer's coming. I'm not finding the link to the car repair program on the foundation site. Thank you. I didn't realize there was a car repair program actually, but I know that there are quality of life programs at the MS Foundation. They're assistive technology or healthcare assistance. If you just go to the web that you see on the screen behind me, or call the toll-free number and ask about that, somebody can direct you to the right location for that. I'm just clicking off some of these that I've already answered. I'm sorry, my screen is full. Louise says, I have a fantastic team in the UK, but I have to say you and Ben Thrower have been brilliant to listen to on these webinar chats. Oh, thank you, Louise. I appreciate that. Dr. Erin Boster is another really great regular contributor. And so the three of us have a number of past webinars up on the Multiple Sclerosis Foundation YouTube channel, and you can go in and catch those at any time. So if you're looking for answers to a specific question or topic and we don't happen to be on the schedule that you're aware of, do go ahead and look at our YouTube channel. Let's see, just scooted out. Heather from Facebook asks, can MS cause severe anxiety and panic attacks due to lesions on the brain and other mental health issues? The anxiety may not be due to lesions on the brain. It may be due to a fear of the future, of not knowing what's coming down the pike, of am I going to be able to get back to work again? How am I going to handle this financially? How am I going to take care of my kids? There is some evidence that other mental health issues, particularly depression, can be related to lesion placement. I know that I struggled with really severe depression for more than 20 years. But after I got onto an effective disease modifying therapy, it began to ramp down. And after a year or so on my second disease modifying therapy, which was several years ago now, the depression just lifted. I think it's because the inflammation in the central nervous system gets calmed, and it's not sort of battering on those lesions anymore. So whatever you can do to calm that inflammation in your central nervous system, to take the teeth out of this thing we know as MS, the better. So Shalane says, I'm trying low dose naltrexone for release of symptoms. Not sure if it's helping or not. Do you have any statistics related for MS patients? LDN, low dose naltrexone, has been used off label. It's not an approved treatment for MS. And it seems to, the people that are reporting the greatest improvement with LDN are generally those who have secondary progressive MS, not relapsing remitting MS. They're reporting a lifting of mood. They're reporting better sleep. They're reporting even their walking is improved. And I think part of that is because for some people, they're less fatigued. It does not have an impact on our MRI outcomes. It does not have an impact on the lesions that are there. It does not slow the progress of the disease. But if you're secondary progressive MS and you don't have an active form of MS, some people feel that it's very helpful. LDN is a product that has to be formulated at a compounding pharmacy. Last time I checked, it's generally about, I would say, $50 or $60 a month from a compounding pharmacy. 2 standard doses are 3 milligrams and 4.5 milligrams, and you usually take it in the evening rather than in the morning. I found that I've been a chronic insomniac for years, and I found that in the brief time that I tried LDN, it just wreaked havoc with my sleep cycle. And I had to go off of it after a couple of weeks, and it took me a good couple of months to get my sleep cycle back in order. I think that may be one of the reasons why a lot of people are telling us that they get some relief from their fatigue with it. But it did mess with my sleep. So just a warning. Just one new message. Let's see. Aaron from Facebook says, can MS affect your weight? I was diagnosed 4 years ago. I think that MS doesn't necessarily affect with our weight, but certainly some of the drugs that we take for MS do impact the weight. And the big one is steroids. If you're having like a 3 or a 5 day course of IV Solumedrol, you can almost be guaranteed that you're going to put on long-term 2 or 3 pounds from that. And every time you add more steroid, more weight is likely to go on if you have a propensity to gain weight. Other medications, like many of us are on antidepressants. Antidepressants are known to put on weight in most cases. So many of our medications can do that. An anonymous attendee from Zoom says, I live alone. I have secondary progressive MS. Do you have any suggestions for getting into a low profile bed? Leg lifter doesn't work, so I've been sleeping in a lift recliner for 2 years, and I would love to sleep in a bed again. A physical therapist can help you with that. But I think even putting your bed up on blocks, having somebody add a 4 or a 6 inch block under every leg of the bed is going to help you get in and out of the bed safely. But I would recommend that you get a physical therapy evaluation and have your therapist give you some suggestions on getting in and out of bed. Familia from Facebook asks, does New Vigil actually help MS patients with fatigue? Some, not all. We haven't found a perfect way to deal with MS fatigue. It varies from individual to individual, as do the responses to the various medicines. So medicines like Nuvigil, Provigil, Adderall are all things that are tried with varying degrees of success. Even amphetamines like Dexedrine may be helpful. But I find that when you're on some of these medications, it may actually sort of trigger a sleep cycle problem as well. They get you too wide awake, particularly if you're taking 2 doses a day. I'd recommend never taking that second dose after 2 p.m. or even afternoon, because it could ultimately impact your sleep. And you don't want to get into a vicious cycle where you're taking something to wake you up and to help with your fatigue in the morning, and then you're taking something in the evening to slow you down and to quiet you down. And that can be an awfully vicious cycle. It's just a chemical disruption of your normal rhythms. The other thing about medications for MS fatigue, they should not be taken on a daily basis. They should be taken when you need to be at your sharpest. If you have young children that you're caring for at home, it's going to be a temptation to take it every day because they use up so much energy. But try to develop a plan with your support system, with family members, or with neighbors to help out with the kids, so that on days when you decide to take a break from the medicine, they can take the kids for a bit while you take a nap and recharge those batteries. You're going to just burn yourself out if you're trying to take it every single day, and it's going to lose its effectiveness, and you're going to need stronger and stronger help and have less and less ability to fall asleep and get good natural sleep regularly. An anonymous attendee says, I've been on Rituxan for 7 years. I'm aware it's one of the best DMTs. Will I be able to take it for the long term, and is it safe? I have been on it for a little over 8 years at this point. It's coming up on 9 years. And I find it's the easiest disease modifying therapy that I've been on over the last 20 plus years. Fewest side effects that are negative. The one side effect that is a potential problem is that it makes it difficult for us to fight infection, whether that be something like the common cold or a urinary tract infection, or something more sinister like COVID or RSV or pneumonia. So we really need to keep up on things like our vaccines. We don't develop antibodies as readily to vaccines, and yet those vaccines are going to give us a little edge over not having them at all. So at the moment, I think the answer to your question is yes, it's probably safe to stay on long term. And it's probably one of the safer medicines. Let's see. Okay, we have time for probably a couple more questions. If anybody has anything that's burning that hasn't been answered yet, I do need to finish this pretty close to the top of the hour because I have to take my neighbor to the airport in just a few minutes. But I can certainly answer another question or two if there's any concerns. And in case you weren't here at the beginning of the webinar when I made announcements, the cooling program, which ends on June 1st, has an application in the winter issue of the MS Focus magazine. If you have not ordered cooling equipment from us in a 5-year period, you are eligible to put in an application. It's on page 47 in in that winter issue of the magazine. It's also, if you go to msfocus.org behind me, the website behind me, and just type in cooling program when you get on the website. It'll bring up the application as well. Also, we are in the process of launching a new closed private Facebook group for those of you who identify as LGBT or Q and are living with MS or are in the process of being diagnosed with MS. It's a place where we're in the process of setting up a wide variety of resources and for individuals in that community. So feel free to look for the website MS Focus on the LGBT community. Let's see, when will the magazine be sent? I signed up several sessions ago. The magazine is sent out quarterly. The winter issue of MS Focus magazine came out about 4 weeks ago. The next issue, the spring issue, I believe will probably be sent out in another 4 or 5 weeks. Summer issue should probably be out at the end of July or early August. So you can also get the MS Focus magazine online. We have several years of past issues available. So it's msfocus.org/publications, and you should be able to find all of the issues of our magazines. Are you guys working on an app? An anonymous attendee app asks. I'm not sure. An app for what? You can go in on your cell phone and go to msfocus.org and find everything that you need with that. As far as an app, I'm not sure what you're asking. Heather from Facebook asks, what are your thoughts on Kesimpta as a first DMT? I think it's a highly effective first DMT, and the shift really over the last 5 years has been away from moving away from a step approach, meaning you start with something that's older that we know is safe, but may not be as effective. And if that's effective at keeping your disease process at bay, that's where you stay. The thoughts on the reverse of that is an accelerated therapy, which means you go on to a very highly effective medication right at the beginning, and you may never progress beyond that if you get onto an effective medication at the beginning. And yes, that is an effective medication. Stephanie from Facebook says, what do I do if I can't get my neurologist to understand I feel worse, even though my recent MRI shows no change? The year before there were changes. What I say about how I feel isn't recognized. Stephanie, you very well may need to have a pointed conversation with that neurologist and just let them know that you do not feel heard. You do not feel that they're listening to what you're saying. You can have worsening disease without MRI changes, and that may signify that you're transitioning into secondary progressive. It may signify that you need to be on a different disease-modifying therapy. So ask the doctor, may I please switch disease-modifying therapies? I just feel like I'm not doing well on this therapy anymore. Be honest with them. That's really necessary. It's needed. I thank you all for your attention, your time, your questions. This conversation will be on the Multiple Sclerosis Foundation page, and it will be up indefinitely on that page. And within the next few days, you should probably see this conversation up on the Multiple Sclerosis Foundation YouTube page. And Bhavya?
Well, thank you, Cherie. You did half my job. That brings us to the end of our time. If you missed any part of this conference, like Cherie just said, it has been recorded and is available through the MS Focus Facebook and YouTube channels. You can reply to your registration email for information on how to access these recordings or sign up for our newsletter to learn about upcoming events. Our next teleconference will be next Wednesday, April 26th at 6 p.m. Eastern with Oscar the MS Monkey to discuss dating for teens and young adults with MS. As you leave the conference today, there will be a survey that appears on your screen. We ask you please to take a moment to give us your feedback on this program and your suggestions for future topics, so we can be sure to provide you the best programs possible. Our sincere thanks to all our attendees for your participation and active questions, and especially to Cherie. Thank you so much for your time and all the time you take to prepare and share all your knowledge with us. We really appreciate it. Thank you, everybody. Have a great day and enjoy the rest of your weekend. Bye.
Bye.